Welcome to the BioMedWire Podcast, powered by IBN. This original audio production delivers market and sector insights, as well as exclusive interviews with innovative executives shaping the future in fast-moving industries, and may feature a client partner of IBN or one of the 60-plus investor-focused brands within IBN's dynamic brand portfolio. As a multifaceted financial news and publishing company, IBN leverages its extensive distribution network, utilizing multiple proprietary corporate communication tools to introduce both public and private companies to a vast and diverse audience of investors, consumers, influencers, journalists, and other targeted segments of the public. IBN may have received compensation to produce this audio content. Please be sure to read IBN's entire disclaimers for full disclosures. Now sit back, relax, and enjoy the next revelatory episode of IBN's BioMedWire Podcast.
Hi, and welcome to another exciting interview where we bring you the latest in the stock market news and companies doing fantastic things across the board. I'm excited to sit down today with CEO Shane Speirs. He is with Adageis, and they are a healthcare technology company dedicated to revolutionizing patient care through innovative value-based care solutions. Shane, welcome to the show. Excited to have you here.
Excited to be here. Thanks for having me.
Yeah, so off the bat, give us a brief description about the company itself, what your main mission is, and just bring us up to speed with who is Adageis.
Yeah, of course. So healthcare is a complicated place. Navigating the healthcare system for a patient is extremely difficult these days. And on the healthcare provider, healthcare delivery side, it's also tough. Classically, there have been different reimbursement methods towards how you reimburse for healthcare services in the United States. Where the world is going these days, which I believe and a lot of people tend to agree, is towards value-based care. And you see that hot word in the marketplace a lot: value-based care, high-quality care, try to be proactive in care. And, one question I like to ask a lot of people is, does anyone really know what that is or how we get there? And people have trouble answering that. And what Adageis does is we bring a simple solution to healthcare organizations, large, multi-state, multi-specialty healthcare groups, to, single Dr. Smith who owns his own practice on, the west side of town here in Phoenix. We bring a solution that fits that need for everyone. And what we really do is we help providers, organizations drive revenue from providing high quality care, which is something that everyone can align with.
Awesome. So looking at the platform itself, I see that Adageis is labeled your virtual quality care manager and productivity suite. Tell us about its distinct focus on predictive analytics and AI, especially to model customer patient care.
Absolutely. So a lot of the value and value-based care is coming from, well, how do you provide proper documentation or towards your patients, to their medical issues, how you're being proactive in care, like making sure people are up to date on their breast cancer screenings, on their colonoscopies, controlling their high blood pressure, controlling their diabetes, et cetera, et cetera. And what we do is we provide an easy solution for them to say, hey, these are the metrics that I need to hit for my patients, not only to provide high quality care, but to also maximize how I'm getting those incentive dollars from providing that good care. And one of the big issues is when you're out in the marketplace, let's say I owned my own clinic, there's over 100 different insurance companies with over 1,000 different plans in the greater Phoenix area alone. That's a fact. What is the problem with that? They all have different measures and they all want you to document it differently in order to hit those. And what Adageis has is, we have a solution that makes it easy to follow those, to say, hey, this is my patient. This is what I need to hit as far as my quality, to maximize the revenue that I'm getting to providing the high quality care that I'm already doing. Because the next best solution out there is, I sit there, so I'm a physician, I'm actually a geriatrician, so I provide care to older adult patients. I don't see anyone younger than 75, so you are a very young individual in my world. But when I'm looking at my patients, the next best thing out there, which is why we designed Adageis, is I sit there with a stack of PDFs that big and try to sort through, well, Carmel has, Blue Cross Blue Shield, which falls under this incentive plan, which means I have to document that I did these quality measures in this type of way. That's not feasible. So we have a solution that integrates with almost 100 different electronic health record systems. There's no flipping back and forth between screens. We fully integrate. It overlays your existing electronic health record system platform and provides those easy to read measures that you have to hit depending on what insurance your patient has. And so that's what we do.
Wonderful. Yeah, it definitely seems like the right time to, take away all those obstacles to efficiency, obstacles to speed of effective delivery of these patient cares in different ways. I'm loving what I'm hearing because it's obviously super needed. Now, your platform integrates with existing EHR systems. You were speaking earlier about some challenges that you've encountered, but speak to us particularly now about the challenges that you find in maintaining seamless interoperability while implementing the AI-driven analytics.
Yeah, absolutely. I mean, so we have a large amount of integrations. I said almost 100, and I think it's up there in the 80s, 90s, somewhere close to there. And what's the problem? Well, they're all very different. Their data is stored differently. Their back end, it looks completely different. Their APIs are different. And even some are cloud hosted and some are on-premise hosted with local servers. And so there is a challenge there. But in our world, that's something that we continuously work towards. You have to monitor those integrations and make sure your system is continuing to work. And it's important that we have that robust offering to work with so many electronic health record systems because we truly want our clients to have a seamless solution across all platforms. We don't want to work with just one or the other. We want to say, hey, no matter what platform you're on, this is a service that you can provide. And actually, if you want to switch platforms, that's a seamless answer for you as well. So you're not locked into using us with the specific electronic health record system because, as you know, Carmel, the healthcare world is always changing. Someone's making a change to a bigger and better system. Someone's upgrading from an old version of a system to a new version. And that's just the world that we live in.
Oh, yeah. Constant evolution and change. And, we've got to keep up, especially in healthcare. So you spoke about monitoring. And I guess that's one part of my next question. How would you go about quantifying and measuring the impact of your risk analysis algorithms? Well, these algorithms on patient outcomes, and let's look at it in particular to high-risk populations.
Absolutely. So actually, the patented aspect of our system is one that monitors high-risk patients. So what we do is we use algorithm to calculate the risk of each patient with everything in the patient's chart, from lab values, diagnosis codes, vital signs, etc. And we throw them into an algorithm, all of those measures, and the output basically tells you, hey, how high risk is this patient? We bucket it, let's say, on a scale of 1 to 10. And you might have a patient with a risk level 1. And let's just call that a 16-year-old female with no medical issues, really healthy, hasn't been to the hospital ever. And a risk level 10 might be, a 92-year-old male with advanced dementia who's fallen 3 times in the past 90 days, who's been in the hospital twice within the last month. Let's call that patient a risk level 10. So we tie each one of those risk levels to a timer mechanism. So for that young female, her timer may reset every 300 days. And for that high-risk older adult male, that timer may reset every 30 days. And so by the inherentness of our system, we've patented how to monitor those high-risk patients, or what I like to call allocating more resources to those who need it most. I mean, I'm a geriatrician by training, so I like to use the older adults as an example. In my opinion, they need, I would say, in my biased opinion, they need more care than the general population, which I think, people would tend to agree with. But that's not only a way to monitor high-risk patients, but it's a way to turn your healthcare system from reactive to proactive, right? Our providers that use our system are being queued up with these high-risk patients more often because they're higher risk. That timer resets at a higher frequency. And so that's why we actually call it the proactive care platform, where we monitor those high-risk individuals and help you change your system from reactive to proactive. And that goes to something you mentioned earlier. One part of your question was, well, how do you monitor how that's helping the system from a revenue standpoint, from a cost saving standpoint? And I would say I would answer that in two ways. The inherentness of our system allows you to track the reimbursements that you get from those quality incentives that I mentioned earlier, whether that be colonoscopies, annual wellness visits, et cetera, et cetera. Those all have dollar amounts associated with them. We allow each user to track that over time. So you can look back and say, hey, this is how I've done month over month, year over year. And then the second aspect is organizations are being rewarded for MLR, which is basically a way that insurance companies are helping to incentivize healthcare groups or physicians, providers to provide high quality, low cost care. And MLR measures, well, what is the overall cost of care for that patient to the healthcare system or their insurance company as a whole? And so we review those, with the clients that we have on Adageis, and they're seeing benefit because, as you might imagine, when you're being proactive in care, monitoring your high risk patients, focusing on your quality of care, that number is going down. And so those are all parts of the system that we offer to our clients today. And we see real world results every day, every month, every week, talking with these clients. And that's a nice thing to be able to say.
For sure. And just for clarity, who are your clients? Who is the main end user?
So the main end users are, multiple people within a healthcare system. And so I'll give you an example of a small group and a very large group. So if you're, at Adageis, we contract with our clients based on a per provider per month cost. And that allows however many users you want on the platform. And so if you have Dr. Smith, who owns his own practice, he has his office manager who can review these measures, see how the organization is doing day over day, month over month, week over week. His medical assistants can use it to queue him up to say, hey, these are the quality measures that you need to hit for these patients, or hey, I'm going to focus on your high risk, bucket. Let's call and make sure these patients are getting in. To Dr. Smith to say, hey, these are the quality measures I need to hit to make sure that I'm getting the most bang for my buck, because I'm already providing this good care. Why shouldn't I get rewarded for it as well? Providing him a way to see, hey, these are the quality measures I have to hit for this patient, and this is how I have to document in order to get that revenue for providing this high quality service that I do. So that's one instance that you might see in a small medical group type setting. In a larger healthcare type setting, we have clients that are multi-state, multi-specialty. They have their front office staff using this to schedule those high-risk patients to get in. They have their medical assistants queuing up, hey, we need colonoscopies, breast cancer screenings for all these patients that are outstanding for the year. We have providers using it across different specialties, recognizing that some quality measures are used for different providers. Like, for example, a primary care provider, one of their measures might be controlling high blood pressure. And then we have groups that have, pain medicine on board. And so a pain screen is one of their quality measures. And so they use that. And then actually we, as part of those large healthcare systems, we have executive teams, managers, a lot of them have centralized quality systems already. Like there are, for these multi-state, multi-specialty healthcare groups, they have huge departments that just focus on these things as is. And we're providing them a tool that says, hey, instead of going off of endless Excel spreadsheets, trying to coordinate amongst your team, here's one solution that we load the data every 24 hours. Our data is never more than 24 hours old. We have one place where you can go to find all of this information, and they have their quality teams using this as well to monitor how quality is doing, to monitor those patients that need to hit their metrics or the high-risk patients who they don't want to fall out of care or end up in the emergency room with a bad outcome. And so that's how it would work from a small organization to a large organization. And of course, it works for everyone in between as well.
Awesome. And I'm just going to touch on a few of the things you've said and kind of, gain a little more insight there. So I'm hearing that there could be some unexpected insights that potentially you've discovered or your AI system has uncovered in relation to healthcare delivery patterns. Can you speak to us about anything that you've come across that may have influenced business decisions, particularly around supply chain, facility locations? I mean, you mentioned somebody who may need to get into urgent care for whatever reason. Speak to us about, again, supply chain, facility locations, and how perhaps you've uncovered certain insights that's shown, okay, well, healthcare delivery patterns were at a lower par, or what have you discovered? Let's just find out if there's anything.
No, it's funny, and it's funny that you asked that question because as we designed Adageis, this is something that we developed over years and fully launched the product less than 12 months ago. And it has these good, unexpectedly good outcomes, if you will, for what we see with some of our clients. And I would say this, on clients large or small. So there are studies out there these days that, value-based care 5 years ago used to be, if you're in a primary care group, 25% or less of your revenue is from these value-based care type of measures. Less than that if you're a specialist, like, a cardiologist, a dermatologist, etc. These days, they estimate that if you're a primary care group, around 50% of your overall revenue is coming from some sort of value-based care incentive, which is a ton, right? Half of your organizational revenue is coming from providing high-quality care, which, in my opinion, is a great thing. We should be rewarding people or trying to influence our healthcare system to providing high quality care. And then, obviously with pain medicine, dermatology, we're floating around less than 50%, but it's still a growing number for sure. And one of the biggest aspects that we see when we onboard people to the system is they say, wow, I didn't know that I was missing out on so much revenue from these services. Because one of the inherent aspects of our system is you get to say, hey, for each provider or for each medical group or for the entire system, here's how much dollars I've collected for my value-based care measures for this year or for this month. And here's my opportunity. Here's what I could be making if I was maximizing it. That's an inherent part of the system. And so I would say the biggest thing that we see is clients say, wow, I didn't know I was missing out on so much opportunity with these services, which is great. It's an easy sell from our platform as a whole. But it's funny, to your question about whether it's facility location, supply chain, et cetera, more on an organizational macro level. It's funny that you mentioned that because we're starting to see organizations making proactive decisions based on the system to say, hey, I've noticed there's a lot of high-risk patients, within this region. Let's have another facility go there. Or say, hey, we're doing bad on our high blood pressure measure. We need to put a cardiologist or a nephrologist in this facility. It's actually helping make organizational staffing, operational changes based on the data that we're giving them, which is excellent. I mean, that's something that it has been very hard to get for a lot of these organizations before our system. And so that's a rewarding thing. That's a rewarding feedback for us to hear as well. I mean, that's not as much tied to revenue, immediate benefit, but it's helping organizations plan for the long term, which I think is very important as well.
For sure. Yeah, to help plan for those addressable markets and just improve healthcare all around.
Agreed.
So can you share any specific metrics on how your proactive care platform has improved reimbursement rates and quality scores for your clients?
Absolutely. And so it's funny, if you go to actually our website, we have a little dashboard that's set up right there. It's right on the homepage that says, hey, what type of providers do you have at your organization? How many providers do you have? And here's what we're seeing as an average for our Adageis users of what kind of revenue numbers they're driving from the use of our platform. And I will tell you, that's something we use on our pitch for new clients as well. It's to say, hey, we're seeing an average of over $100,000 per provider if you're in the primary care space from taking advantage of using the Adageis platform, which is awesome. That's excellent. And you have organizations that are already doing pretty well, still seeing benefit. And then you have organizations that are struggling to make that to transition to value-based care, seeing a high level of benefit. And it's funny, one of the things that we see is it's beneficial to both. I mean, I think it makes sense for someone that's having a hard time making the transition to value-based care. What do we do? How do we navigate this ever-growing complexity of, all these different insurance companies and these different metrics? That's an easy sell. It's right in front of them. It integrates with their existing EMR. But what we see a lot from our clients that are really trying to drive that value-based care system home is not only are they seeing additional revenue opportunities from what they currently have, but they're being proactive to say, I haven't contracted with United Healthcare for their quality incentives. I need to reach out to them. Or, hey, I'm not part of this clinically integrative network or ACO for my Medicare patients. I need to get on board something so I can start to capture that additional revenue. So we see all along that continuum of people, medical groups struggling to doing, pretty well with it. We're able to help everyone on that continuum, which is great.
Yeah, fantastic. And just to remind everyone out there, if you want to check out that ROI calculator on their website, the site is adageis.com. That's ADAGEIS.com. So healthcare data security obviously is crucial. What unique approaches does Adageis take to protect sensitive patient information while leveraging AI capabilities?
Very good question, which is actually a hot topic over the last 3 or 4 weeks. Is CMS announced that they were going to increase the HIPAA privacy requirements. I think it was 3 weeks ago. Don't quote me on that, but it's somewhere between 2 and 4. To basically, they were going to demand that there was, dual authentication, certain security measures based around any data that you're warehousing. And I will say this, we're ahead of the game. Everything's housed in the cloud, AWS, HIPAA compliant servers. And we do have those authentication security measures already in place. So that's music to our ears. In general, people like to focus on HIPAA for healthcare, but, different business entities, banking has certain requirements, depending on what business field you're in, there are requirements for security. But in my opinion, especially in healthcare, when you're housing important information about people's health, that should be top of mind at all time. And so we really do take that next level approach, cloud security. Everything has that dual protection layer already associated with it. So that is a non-issue for us. We're ahead of the game there. The nice part about, being in a startup world is we built our system, just 3 or 4 years ago. And so we've incorporated that latest technology, those security layers into our system from the get-go. And so that was a positive. I mean, when you look at startups, there's always positives and negatives out there. It's easy to change. We're housed in the latest and greatest AWS servers. And so that's security that we're already able to meet with our existing system.
100%, totally agree with you. Talk to us now about adoption rates. Many healthcare innovations fail because of provider resistance. Have you experienced this? And then how have you designed your interface to ensure that there's a high adoption rate among clinicians?
Change is hard, especially in the healthcare world. I've worked for a number of different organizations as a care provider, and it's hard to change. The main goal of Adageis was to make that transition to value-based care easy, to provide a simple solution that a provider or someone at a healthcare organization can learn in, under a handful of minutes. And I believe we've delivered on that. But there's always two sides to the story, and that is you have to get buy-in from your customers, whether that be you're contracting with Dr. Smith and you have to get buy-in from his team at his, single clinic, or you're contracting with a large multi-state, multi-specialty healthcare group, you have to get buy-in in some way, shape, or form. And so that's an expectation that we set with our clients up front, whether it's, Dr. Smith providing some sort of, incentives to his team in order to help him hit his value-based care measures, or to those large multi-specialty, multi-state healthcare groups to say, you have to incentivize your team members, your healthcare providers, your doctors, in order to hit their quality measures. Otherwise, this isn't going to work. I mean, it's important that we align our views as healthcare organizations with our providers, with the insurance companies, and with the patients, which I tend to be a positive person. I believe the world is going in that way, but you have to align everyone's values and provide some sort of reward system for providing this high quality of care, these value-based care measures. Otherwise, it's just not going to happen. And so when we first meet with our clients, when we get them on board at their first onboarding session, this is something we mention every step of the way. And as a matter of fact, we have sample, bonus structures or compensation structures that we give to the organizations that we contract with. Say, hey, this is what we've seen in the marketplace. Here's an example of what you might decide to do in order to reward your care team for providing that high quality care as well. But to your point, it's super important. Change in healthcare is hard, as we all know. And that's something we continually work towards as well. And I'll add in one more thing. That's why we have regular meetings with our customers, our clients, our care providers, is to say, hey, what questions do you have? How can we help? Are there improvements we can make to our system? I mean, we're certainly not perfect. We've improved quarter over quarter, year over year to try and make it easier to navigate. But all of these are part of the system as, hey, how do you help move this change in a better direction for everyone, for the patients, the healthcare system as a whole, et cetera?
For sure, with time, and once they adopt to the product, with many other things AI related, you discover how easy it really is, and what a blessing it is to your everyday. So I look forward to hearing more as we catch up with Adageis going forward on that adoption rate. But for now, let's talk about stakeholder goals and how you balance the sometimes competing interests of providers, payers, patients within the system design of Adageis platform.
Absolutely. One of the most important things that we have to keep top of mind all the time is who is the end user of your system? Who benefits from this the most? Who did we make it for? And that's the care providers and the healthcare team as a whole. You're how you're rewarded for the value-based care is based around your healthcare team and what they do. And so it's important that we always keep it provider centric. And when we look for feedback, I mean, that's a true statement. We go to our care providers. We have a whole mechanism where we're saying, hey, how can we make this better? And I was on a call this morning before we had a chat about, hey, an improvement that we thought we could make relatively quickly that one of our medical groups had asked for. And so that's what you always have to keep top of mind is how do you make this easier on the healthcare providers? And I will say this, one of the recent things that we incorporated into our system was an AI scribe that actually, does produce ICD-10 codes or a coding system for you. So you're properly documenting the diagnosis that your patient has. That's part of the output. It's an ambient listening, fully AI scribe. You can tell the difference if, let's say, if you're my patient and we're in the exam room together, it just listens to what we're saying and creates a note for you with those diagnosis codes attached. And that's something that we brought into the system in our latest update because, one, that's important for the overall value-based care, documenting your patient's illnesses, your diagnosis that they actually have. But two, by implementing that, you're truly making the provider, the healthcare system's lives easier. If you're doing the documentation for them, that's more time that they can spend with their patients. And that's what we keep top of mind, whether it's system design, incorporating new aspects into our system, et cetera, et cetera. That's our end goal. Now, we allow payers or insurance companies to access our system. We have, if you're a part of like an accountable care organization or clinically integrated network, they can have access to our system for just, their patients. And so that's an functionality that we have as well. But that being said, although it's important to provide them access, you want to make sure that you're a provider-centric solution.
For sure. Now, just to close off the interview, tell us about emerging healthcare delivery trends that Adageis is positioning itself for to address in the next 3 to 5 years.
For sure, my favorite topic. So, as a growing company, I think it's super important to try to say, hey, what are the trends? Where are we going in this space? And one of the biggest trends is, value-based care. From what I see, is based on two main ideas. The first is your value-based care measure. So are you getting your patients in for their annual wellness visits, controlling their diabetes, controlling their high blood pressure? Are they getting their breast cancer screenings, et cetera? The other aspect is proper coding of their diagnosis. So you're documenting how sick your patients are. Those are the two aspects to value-based care. Now, what I've seen is first, CMS has moved from their model of V24 to V28, which basically, in my opinion, which I believe people would agree with, is they're putting less weight on how important proper documentation of diagnosis codes or patient sickness is. And they're pushing more importance towards hitting your quality measures or taking proper care of your patients and actually documenting appropriately for that. Now, I mentioned this earlier in the conversation. I tend to be an optimist, but I think that's good for a number of reasons. The first is, it is important to properly classify how sick your patient is. But I think really how you switch from being reactive as a healthcare system to proactive is by making sure you're being proactive in their healthcare, controlling their chronic medical issues, making sure they're getting their appropriate screenings, et cetera, making sure they're coming in for their annual visit. And so what I see out in the world, as I still practice, plus I'm very active in the, community, is I see a greater push towards the value-based care metrics and less of a push towards the proper diagnosis of your patient's risk via diagnosis codes. And so, that is although the Adageis system is set up to do both, I believe the more difficult aspect that I see in the community is those value-based care measures, right? Like truly combing through a bunch of PDFs to try and figure this out is a near impossible task. And so when I look at how we've positioned ourselves in the market, I believe the market is going to be pushed more towards the quality measures in at least the next 3 to 5 years. And so that's great for us and great for the patients and what I believe great for the healthcare community as a whole.
Wonderful way to end off this conversation. Excited to keep up with Adageis, a healthcare technology company dedicated to revolutionizing patient care through innovative value-based care solutions. CEO Shane Speirs, thank you so much for joining me. You guys stay tuned for more.
Thanks, everyone. Have a good day.
The BioMedWire Podcast is an original content production powered by IBN, a multifaceted financial news and publishing company that delivers next-generation corporate communication solutions. Utilizing proprietary corporate communication tools such as news aggregation and syndication, social communication, and brand awareness techniques, among others, IBN introduces both public and private companies to diverse audiences to enhance reach and recognition. IBN may receive compensation for services and solutions provided to its client partners. You should assume that the owners, officers, and directors of IBN or financial analysts mentioned in this production may hold a position in and may intend to trade the securities in their own accounts. This production is not an offer or recommendation to buy or sell any securities that may be mentioned in this production. The information in this broadcast is presented solely for informative purposes and is not intended to be or should it be construed as investment advice. As in all investments, investment in the featured companies carries inherent investment risk. Listeners should review the companies thoroughly with a registered investment advisor or registered stockbroker. This production by IBN is not purported to be a complete study of the featured company or other companies mentioned. Information used in statements of fact have been obtained from featured companies and other sources but not verified nor guaranteed by IBN as to completeness and accuracy. Such information is subject to change without notice. Please see IBN's full disclaimers and disclosures at www.ibn.fm/disclaimer. Music in this episode is by Infraction. For more, visit inaudio.org.